So let's continue with the urinary system, and in this video we will continue to focus on the disorders of the kidney. So the most serious diseases of the urinary system are those that affect the kidneys. Nephropathy is a general term for kidney disease. Pathy, disease, nephro, kidney, disease of kidney. You could have acute and chronic infections to inflammatory disease to kidney stones to tumors, benign or malignant cancer that may impair your kidney functions. And this can happen not only because something is wrong in the urinary system, but it could be because of something that is going wrong in your body outside of or beyond the urinary system. So you may have a hypertension or diabetes or some connective tissue disorders that can damage your kidneys. So in this video we will focus on the pyelonephritis. Itis means inflammation. Pyelonephritis, so pelvis, kidney, infection or inflammation. So the inflammation or infection of the pelvis of the kidney, right? So it's a bacterial infection that causes inflammation of the kidney and its pelvis. The microscopic evidence of inflammation is seen in the glomerulus and collecting tubules. Pyelitis, if we go little down deep, pyelitis is the inflammation of pelvis. But you cannot have inflammation in the pelvis, that is recall the first presentation, first slide about the components of the kidney. You cannot have the inflammation in the pelvis without not having any portion of the kidney as well. So instead of just saying the pyelitis, the correct medical term is pyelonephritis, because it is the inflammation of the pelvis as well as the part of the kidney. So as in many diseases we see that it could be acute or chronic. Same thing is true with the pyelonephritis. It may be acute, it may happen suddenly, or it may lead to a chronic version. Acute pyelonephritis is a bacterial infection of the kidney that appears suddenly and is characterized by, and these are the symptoms: high fever, rapid pulse, pain in the flank, frequent urination, painful urination. Okay. The infecting organisms usually ascend to the kidney from the lower urinary tract. So this is something to note, that it goes from down to above, from urethra to bladder to ureter to kidney. But it does rarely happen that because of something above, through the bloodstream or through the lymphatic system, that may also once in a while contribute to this disease. So the predisposing conditions for acute pyelonephritis include urethral strictures, reflux, tumors, stones, neurogenic bladder, and we'll get into some of those in the subsequent presentation series. The urine sediment of a person who has pyelonephritis is loaded with white blood cells, bacteria. You may have a red blood cells and the cast also in the urine. For those of you who may not be familiar with, urine sediment is like you spin the machine. So urine sediment is obtained by spinning a urine sample in a machine called centrifuge. Those who are working in the lab, they know what this is, as they do this and see this every day in their daily routine. So a urine culture is included in any thorough investigation of any attack of this called pyelonephritis. And one could have just one attack or a frequent attacks. So the initial culture identifies the specific offending organism or organism, and further testing shows the sensitivity of the offending organism to various antibodies. The prognosis as it relates to the pyelonephritis, possible that one may have a acute pyelonephritis and you may recover fully if there is one attack. Second attack, yes, you may feel some pain, some challenges. If it continues and it continues to happen, then it may lead to what we call chronic pyelonephritis. So as the word chronic suggests, it's a slowly progressive infection that usually affects both kidneys. This condition may be associated with the persistence of a kidney stone. So one may have a kidney stone that keeps happening, that may eventually lead to the chronic pyelonephritis, or any kind of obstruction in the urinary tract, or you may end up having this chronic pyelonephritis because of recurrent attacks of acute pyelonephritis. Okay, you may have a situation where you may remain symptom free and still you may have this and you may not notice, and we'll get into the limitations of the lab test and all that later on. But protein in the urine or the pus or the white blood cells in the urine are typically present. You may have it intermittent. Recurrent attacks are characterized by fevers, headache, fatigue, loss of appetite, and that leads to weight loss. You constantly feel thirsty, back pain, painful urination, and of course, unfortunately in advanced cases or the advanced stages of this disease, it may lead to the renal failure and or hypertension. Now we are talking about chronic pyelonephritis, inflammation in the pelvis of the kidney and or the kidney. As opposed to that, remember that 1 to 1.2 million tiny filters that we talk about, that is glomeruli, right? You could have inflammation in those tiny filters, or you could have in the pelvis of the kidney and or the kidney per se. So terminal stage of either of these conditions are clinically hard to distinguish. I got some slides for you to show because seeing is believing and it makes more sense. So you have a normal kidney, and you have a kidney where there is inflammation in the pelvis of the kidney and or in the kidney. So now you know these terms, the different parts of the kidney. This one is normal, whereas there you see the inflammation. You may have pus, you may have scarring. That's the pyelonephritis. Yet another view of pyelonephritis. Of course, when we look at the slide versus when you look at under the microscope, it would make more sense. But even we could see that any diseases like this, how the appearance of the kidney from normal to infected, how it changes. This one is on acute pyelonephritis, and because it happens suddenly, it's non-specific, and it involves by definition the pelvis. And there are data to suggest that 20 to 40% of the patients with the renal diseases suffers from this condition. So imagine how frequently this happens. That's the point. And I like this one because it breaks down and it gives you conceptual clarity of what we are dealing here. Acute pyelonephritis. So acute because it develops quickly. Pyelo means renal pelvis, nephr means kidney, and itis means inflammation, infection. So you can have a bacterial infection right at the pelvis of the kidney, down the ureter, the tube that now we know. Again, one more slide. and you see that you may have acute and or chronic, or the acute may lead to chronic, and this one is on the chronic pyelonephritis, where how the appearance and the look of the kidney from a normal to chronic pyelonephritis. You have a blunted calyx and you have a scar here. Okay, so watch these slides again to familiarize yourselves and go through the different terminologies to raise the acquaintance about your understanding of the various aspects of the urinary system. And I have broken it down into different segments so that it can be easier for those of you who do not have any medical background even to digest this. Okay, I'll come up with another aspect of urinary system. See you soon. Take care. Bye now.